we're honored today that one of our patients made a trip all the way from New Jersey to tell her story. It's one thing to hear a story from an investigator and being all excited about their work, but to actually hear it, what a patient goes through in their life is humbling. It's a different perspective. When you're in a doctor's office and you hear a little snippet and you think you can do something, it's a tiny fraction of what a person actually experiences. So I thank Lynn for coming over and sharing her story.
Thank you. Okay. So when I tell my story, many people ask me, how did you not know you had a congenital defect in your pancreas until adulthood? The truth is, there were signs all along. I remember my first bad stomach ache. I was about 10 years old, and I knew something wasn't right. But when I went to the pediatrician, they dismissed it as constipation and sent me home. While growing up, I stayed very active in sports and activities, which also was a great mental distraction to avoid focusing on my stomach pain when it would appear. Pain reared its ugly head again, unfortunately, when I was in college. There were a lot of flare-ups. I had more severe stomach pain and many frequent trips to the bathroom. So, when I moved to California from the East Coast for college, I had more extreme stomach pain than I did in my earlier childhood, and I was admitted to the ER. That was the first time I was told I had pancreatitis. The doctors implied it could be a result of extensive drinking and or partying and using drugs, which I've never done. And when in reality, I had just had a beer every now and then, and I never, like I said, never did drugs. I left the hospital with a sense of dismissal and not knowing why I was sick. And the impression that I felt, the doctors felt that it was my fault. My symptoms impacted my ability to get to class. I was losing weight big time. I still had experiencing severe pain and needed special parking passes to get to class. Despite my health challenges, I finished college during an intense pancreatic flare with the support of my professors and my employer. Eventually, the pancreatic flare receded, and I thought it was all behind me. So after college, I put applications out everywhere. I got a great job in Florida, and they offered me health care at the 90-day mark of employment. About 75 days into my new position, a familiar pain returned, and I became very sick. I went to the ER, where I then again was told it was my pancreas, but they still couldn't figure out what was causing the pancreatitis. I had to resign from my job, and I headed back west as the teaching hospitals seemed better aligned for the care I was needing in San Diego, as this was the advice of my surgeon in Florida. I went to the University of California, San Diego, and the Mayo Clinic in Scottsdale, Arizona, and I still wasn't able to get the answer as to why I was so sick and what was causing it. In all honesty, at this point of my medical journey, I had my last rites read to me about 2 different times, and by 2 different priests who said, oh, you need your last rites. And I said, no, I'm gonna be fine. Thank you for the blessings. As I sat there as if I wasn't present, Father said to my friends, oh, she's in denial. And I said, no, she's not. She's sitting right here. So I can hear you, and it's all gonna be fine. So I decided to move back to New Jersey, and sure enough, 3 months after returning home, I had another flare-up. Finally, there was a doctor at Cooper University, Dr. Adam Elfont, who said, Lynn, we need to do an upper and lower scope, but the potential of causing life-threatening pancreatitis is very real. I said, I already have life-threatening pancreatitis, and we gotta do this. So at 29 years old, I finally learned I had a congenital defect with my pancreas called pancreatic divisum. And during normal early childhood development, most people have 2 pancreatic ducts that fuse or mend in together naturally. and mine did not. Of the remaining 5 to 10% of patients with with pancreases who don't fuse properly, like me, only 2% have pancreatitis symptoms and big issues. Dr. Alphonse said my pancreas was as hard as a rock and needed to be removed as soon as possible. He wanted me to go to Johns Hopkins for surgery, but I was hesitant to make that irreversible decision as I didn't want to take immune suppressant medications for the rest of my life. And Dr. Alphonse helped me. He listened. So he also helped me to investigate other options, and my friends and family became investigators and a better treatment plan along with us. I've had multiple surgeries with different teams who thought they could help, and ultimately was referred to the University of Minnesota, where they did a complete and rare and specialized surgery to remove my islet cells from the pancreas, clean them, and harvest them in the portal vein of my liver. It's actually called a total pancreatectomy auto islet cell transplant that I had, as if you don't know. The downfall was insurance only covered costs of taking out my pancreas and removing my spleen because it's so vascularly connected and closing me up. When I shared the news, I had to come up with the portion of taking out the islet cells, cleaning them up, and harvesting them. So that obviously needed to be done, and it was about $40,000. And when I was at the university, I said, okay, great, I'll see you in about a month or two. And they're like, no, you're misunderstanding. We have to get the money before we can schedule the appointment. I said, no, I'll see you in 1 or 2 months. And that's how great my family, friends, and community were. And they raised the money for me. And I was able to schedule and have it done. So on July 15th, 2011, I had the total pancreatectomy done at the University of Minnesota, and my health journey didn't stop at that point. Over the next 10 years, my body was adjusting to multiple surgeries I had experienced, missing my pancreas, gallbladder, spleen, appendix, part of my intestine. I had numerous hospitalizations for bleeding ulcers, C. diff, and sepsis infections that resulted in extremely high fevers and seizures. And ironically, while I no longer had a pancreas, I was still diagnosed with pancreatitis. And I had more rounds of antibiotics than I can remember. In January of 2021, back on the West Coast, now in Santa Barbara, I remember having one of the scariest episodes of my life. I went from enjoying a music festival 1 minute to, vomiting blood and ending up in the ER and in and out of consciousness due to internal bleeding. I knew I needed to get to the University of Minnesota for care, and the ER of Santa Barbara stabilized me enough to transport me to Minnesota. When I arrived in Minnesota, Dr. Khoruts met me in the hotel lobby and recommended additional testing for the FMT treatment. Dr. Khoruts was able to confirm through my medical records that I in fact did have C. diff for a solid 1.5 years, and I had qualified for an FMT transplant. After meeting with him, it sure felt like I was finally heard and validated. I think you went in.
To embellish a little bit on Lynn's story, what happens in this rather complex treatment is the gut is restructured. Part of it is cut out along with the pancreas, the duodenum, and then there's some loops that become kind of blind, and there's stasis there, and that becomes a nidus for infections. And what happened with Lynn is she was literally getting hospitalized like monthly with sepsis, life-threatening sepsis, for like 2 years, and giving broad-spectrum antibiotics. And the C. diff part was what allowed us to do this FMT, because that is the regulatory checkpoint for the regulators, that is the one indication where they allow us to do that. But all these antibiotics, it's not just C. diff. The sepsis was driven by other microbes. Under the pressure of antibiotics, they became hostile. That usually goes hand in hand. bacteria that are feeling, yeah, it's like a bad divorce. If you're abusing your spouse, the spouse is going to turn back at you. And that's how those microbes feel. They're constantly getting bombarded, so they're trying to survive and lash out. And that results in sepsis. So at the time, I thought, well, if we attack the C. diff, maybe we can take care of the other bugs. And it kind of worked. And Lynn's story has now been told many times in the workrooms. Her doctor, Marty Freeman, is here today, who is part of the pancreas program. And he's been advocating, we have to do a clinical trial. There's more patients like Lynn. There's like 30 of them having a similar problem. And now, finally, we organized it. We're putting in the application. It went off to the FDA. We're going to do this trial. Lynn is really a patient pioneer. And however it works out, it's going to advance knowledge how to treat patients like her better. Without patients like that, nothing would happen. So, thank you, Lynn. If I could have my last slide, please. Thanks. There's not many political leaders that are worth talking about. A handful. And this one is. He emerged out of Soviet prisons. For those of the young ones, there was this thing called Soviet Union. It was kind of an evil thing. He emerged out of Soviet prisons and became the first president of the Second Czech Republic. And I got this quote of his: "Hope is not a conviction that something will turn out well, but certainty that we do what we do has meaning, regardless of outcome." We're at the Growing Hope. Celebration. We can reflect through this journey of 10 years, and I've been privileged to have personally helped about 1,000 patients. Our research has helped easily tens, maybe 100,000 so far, and more will benefit going forward. And I wish it was all a celebration of all the great things, but I also think of all the patients we didn't have the opportunity or resources to help. And along this journey, we also encountered a lot of human ugliness. Drug companies, greed, drug companies that when they see human suffering, they see dollar signs. Bureaucrats appear to have no soul, worry more about regulatory checkboxes than the human lives behind them. And so it has been a journey to actually confront these forces. Yet, I'm not losing hope. The hope is still growing. Part of the reason is my team. It's an incredible team of people who are dedicated, committed to the cause, and know that we are making a difference. Part of it is collaborators like Cyrus, who really exude energy, and I know they will make a difference as well. But a lot of it is actually you guys who come here. They give me faith in the good part of the humanity. Your kindness, your generosity, your concern for your fellow man is what enabled AC2 to happen, to make a difference. It is really an honor for me to be part of this community. And I invite all of you to stay with it. It's important for our soul to do this work. Thank you so much.